Hello everyone, welcome to another episode of Bone Doctor. In this episode, I am going to discuss about avascular necrosis of hip. Yes, it is a very tough term to understand, but let us understand with a story. A man of around 25 years of age came to orthopedic clinic with pain in his hip joint. Pain in the hips, both hips, predominantly in the right hip. Now this man has no history of injury to his right hip joint. We do the x-rays are perfectly normal, but his pain doesn't go. He comes back after 1 month and the pain is still persisting and the patient is limping. As because the pain is not going for last 1 month, we think of doing an MRI of the hip joint. In MRI, we see that there is changes in the head of the femur of his both hip joints. Predominant changes is in the right, which is more than the left, and the changes are very concurrent with avascular necrosis of hip. That is, the blood supply to the hip joint has reduced significantly, more in the right hip than in the left hip, and the head of his femur, or both his femur, is gradually dying. This is a condition which we call as avascular necrosis of hip. This may occur in any person, in any young person, predominantly in the age of 20 to 40 years of age. So let us understand why such problems occur and what are the consequences of such problems and what are the complications of such problems. So let us first understand what is avascular necrosis of hip, which we also call as osteonecrosis of the head of the femur or the hip joint. Whenever the blood supply to the head and the neck of the femur is damaged due to any reason, due to lack of blood supply, the head of the femur gradually dies. The head of the femur is calcified and the head of the femur is gradually dead. During initial phases of such avascular necrosis, there is reduction in the blood supply. Whenever there is reduction in the blood supply of the head of the femur, pain occurs in the hip joint. A typical dull aching pain which mimics an arthritic pain, a pain due to some muscle injury or pain due to some sprain, etc. Patient cannot locate the pain exactly, but the patient experiences such pain for long periods of time, for months or in some cases years. When the process of avascular necrosis or process of osteonecrosis is complete, that is, head is completely dead, the pain quite surprisingly decreases in intensity, and the dead head of the femurs or the dead femoral heads gradually break down. That is, the surface of the head of the femur gradually breaks down and there is irregularity of the head of the femur, and then the patient develops arthritis of the hip joint, which leads to a limping gait or a painful gait of this patient. This is how the avascular necrosis of the femur occurs. There are stages in which it occurs, and there are ways to identify the disease in early stages. So let us understand how does this occur, why does the blood supply to the head of the femur suddenly stop, and ways to prevent or treat this osteonecrosis at early stages. In cases where the patient is being treated with long-term corticosteroids, that is, the patient is on steroids for long periods of his life, that is for 10 years, 20 years, 15 years. For example, a patient with nephrotic syndrome, a patient with asthma, a patient with other hormonal diseases, in various cases, or chronic allergic conditions, these patients are treated with long-term corticosteroids. When a patient is being given long-term corticosteroids, the patient develops blockage or reduced blood supply to the head of the femur. These patients are prone to avascular necrosis of hip joint. If a patient has suffered dislocation of his hip joint, that is the hip joint, the ball of the hip joint has moved out of the cup and later on it has been reduced back in its place. In cases where the dislocation has occurred, when the dislocation occurred, a very important blood supply to the head of the femur is critically damaged during dislocation. So many patients with dislocation of hip joint may develop avascular necrosis of the head of the femur. It is most commonly seen in cases in patients who have suffered from fractures of neck of the femur or fracture of trochanters. Whenever a trochanteric fracture or neck femur fracture occurs and a surgery is done, even after the surgery is successful, even after the trochanteric fracture is united, patients may develop avascular necrosis or osteonecrosis of the head of the femur due to poor blood supply and damaged blood supply to the head of the femur. Patients with sickle cell anemia, patients with cholesterol excess, patients with glycogen storage diseases, or patients who are suffering from AIDS or HIV and being treated with immunomodulators. These patients are also prone to develop osteonecrosis of the hip joint. So whenever such patients are encountered, we need to monitor regularly for signs and symptoms of hip pain and signs and symptoms of avascular necrosis of the hip joint. So how do we diagnose a patient developing avascular necrosis of femur? Because we know if we can diagnose reduced blood supply to the head of the femur at early stages, we can treat it by various medications, or we can at least use certain methods, surgical methods, by which we can arrest or stop the process of avascular necrosis. First of all, the most common imaging we do is X-ray. X-ray helps us to detect irregularities or excess calcification in the head of the femur, which is a sign of avascular necrosis of the head of the femur. X-ray changes in avascular necrosis occurs in late stages, that is in stage 3 or stage 4. The gold standard method or the gold standard diagnostic tool by which we can detect avascular necrosis of head of the femur at very early stages or stages when it is starting is MRI. In MRI, whenever the blood supply to the head of the femur is minimally reduced or in just it has started, that is in the stage 1, we can detect or see it in the MRI. We can also detect it in bone scans. So whenever we find a patient having hip pain with no changes in the X-rays and no cause to explain such hip pain, we should always undergo an MRI and a bone scan to diagnose whether it is a case of avascular necrosis of hip joint, because early detection in avascular necrosis is fundamental to its treatment. So this is how we diagnose avascular necrosis of hip joint. There are stages in which the avascular necrosis occurs. In stage 1, there is no changes in either MRI or X-ray. There is just reduced blood supply to the head joint, head of the femur. In stage 2, there are changes in MRI. There are changes we can see in the MRI, but there is no changes in the X-rays. In stage 3, the X-ray changes gradually start to appear. The head of the femur appears more calcified. It appears to be more whiter than the normal side. And in stage 4, there are damage to the surface of the head of the femur, and there is beginning of arthritis of the head of the femur and the hip joint. So if we can detect the onset of avascular necrosis in stage 1 and stage 2, that is the best time to treat it or to arrest it and reverse it from its position. If it is advanced to stage 3 or stage 4, where the bone changes, X-ray changes have started to occur, or the head is completely dead, or the arthritic changes have started in the hip joint, we have to go for hip replacement surgeries. As we can see that this type of injury, this type of avascular necrosis occur in young ages, so hip replacement is not an option in these patients who are aged from 20 to 40 years of age, because if we do hip replacement at a very early age, we need to do revision hip replacements at 40 years of age, at 60 years of age, which is quite a complicated procedure. So prevention is the best mode of treatment in avascular necrosis. So what are the ways we prevent avascular necrosis? There are some medications which we use to treat avascular necrosis. Those are some bisphosphonates. Though controversial, but still bisphosphonates are used to reverse the blood supply or to increase the blood supply of the head of the femur. Various statins are used to reduce the cholesterol levels, because increased lipid have shown to increase blockage to the arteries or the arterioles which are supplying the head of the femur. There are various vasodilators medications which are used to increase the blood supply to the head of the femur. The most important surgical method which we apply to this early stage, that is stage 1 or stage 2 of osteonecrosis, is cord decompression. We drill inside the neck of the femur. We make a hole through the neck of the femur up to the head to increase the blood supply or to decompress the neck of the femur. Sometimes we put a fibular autograft through microsurgeries, or we put bone graft inside that hole to increase the blood supply inside the head of the and the neck of the femur. When these techniques do not work and the patient has progressed to stage 3 and stage 4 of osteonecrosis, that is the head of the femur is completely dead and damaged, then we have to undergo hip replacement surgeries to give a patient painless and a mobile hip, so that the patient can walk and pursue his professional achievements. This is how we treat avascular necrosis of the femur. This video was to make aware of the fact that just a simple pain in the hip with no history of trauma or no history of fever can lead to life-threatening or life-changing complications. So any pain in the hip joint which is bothering you for long periods of time, for months or for weeks, should not be ignored and should be diagnosed as soon as possible, so that you don't have to suffer the consequences of diagnosing osteonecrosis of hip late. Hope you have enjoyed the video. If you like it, give it a like and do share the video. If you like my channel, please subscribe. Bye bye for now. Take care.